Welcome to a St. Francis Medical Partners exclusive. My name is Brian Pavlik. I am honored to be here with a wonderful cardiologist in Memphis, Dr. Supreeya Swarup. She is joining me to talk on an awesome topic of women's heart health care. Dr. Swarup, how are you today?
I'm great. Thank you so much for having me.
It is my pleasure. She has been the face of our women's heart health campaign for a few years now. And I said, let's get her on video and let's actually talk to the expert on this subject matter. One that we have talked about doesn't get a lot of love and attention. You know, we usually have hypertension and screenings and AFib and all that. But women's heart health, why is it important? And how can Dr. Swarup help? We're going to talk about that now. But before we get into the topic, we got to meet the woman, because she's an impressive young lady and you'll get to know her. So Dr. Swarup, tell us just a little bit about yourself, how long you've been with us, where you're from, and just a little bit about what you do with St. Francis Cardiology Associates.
Sure. Yes. No, again, thank you for having me. I am originally from California. I did all my training, medical school, internal medicine, cardiology, interventional cardiology in New York and New Jersey, which is where I met my husband, who is from Memphis. So I ended up in Memphis. I've been here for a couple of years now. Memphis is home. It's wonderful to be here. And I'm not going to lie, it did surprise me about how much I really enjoy Memphis. I've been working at St. Francis Hospital since 2019. I have seen all sorts of, disease processes play out, all sorts of patient demographics, and there's definitely room for a lot of improvement as far as disease goes, and women's health specifically is definitely one of them. So I'm glad we're talking about that today.
Absolutely. And, it's funny, we're filming this in April. Mother's Day will be coming up. Heart Health Month was February. And then we've got all kinds of other, celebration months and all, but women's heart health can happen at any time. And that's the dangers of something like this is we just don't know, or we don't even know what to look for. And so I guess the first question, just right from the start, Dr. Swarup, for women, what are common signs of heart disease that women have? And if you would, are they different than men? Are they the same? Kind of just go a little bit about what they're looking for when it comes to heart disease.
Sure, and I think that's a wonderful question because it brings up the whole concept of awareness.
Yeah.
So I think you have to be aware first about your family history, if you can. Obviously, if you don't have any, insider information to your family history, then it is what it is. But genetics do play a huge role in cardiovascular disease. So just knowing your mother, father, your first degree siblings, what sort of disease do they have? At what age did it present? So you are aware that, hey, I'm turning this age, and at this age my father had this, so I need to make sure that I bring that up to my physicians. Usually we start really talking about cardiac disease when somebody hits the age of 40. That is when we start screening them for coronary disease, cardiovascular disease, hypertension, all sorts of things. Women do present atypically sometimes when it comes to cardiac disease. And I'm specifically talking about coronary artery disease. So angina, that presents very differently in women than men. Men will typically have that left-sided crushing pressure like chest pain going down my arm, up my jaw. Every time I walk, it comes on. Women can present with this burning sensation, almost sounds like reflux, back pain between your scapula, sometimes exertional symptoms, sometimes not. So they're very atypical. They're usually in your upper torso, but they're very atypical. So if you are aware that, hey, I have this family history, I have risk factors for coronary disease, could this be my heart saying something? It would trigger something within you to go and seek attention.
Well, there you go. She's already proven she's the expert. Why do we have to go any further? No, we have some different questions and such. But it's an awesome start because, yes, the awareness part of it, like you said, Dr. Swarup, not just the signs and the symptoms, but knowing your family history. And I think that's a huge point. I do not like the fact that you said 40, we start screening. I turned 40 in May, and I know all these screenings are coming my way now, but I understand the age, we can get a little older and all that. You mentioned great stuff about genetics and family history. One thing I want to ask you about is how do lifestyle demographics come into play? Active lifestyle versus inactive lifestyle, more sedentary. What are some things that you've seen from your patients who present? Do you see a difference in if somebody's more active, they may have less, or they may be overdoing it? Just talk a little bit about those lifestyle choices and how that can affect heart disease as well.
And again, this is a very pertinent question in 2023 because we're all living these very busy lifestyles. There's plenty on our plate. So our health sometimes takes the backseat because we're just go, go, go. Being active is only going to be good, not just for your heart, for your whole body, for your metabolism, for your circulation, for your coronaries, for your carotids, for your brain, perfusion. It's just excellent way to get the blood going. So current guidelines state 150 minutes of aerobic exercise where you're getting your heart rate up a week for man and woman, a week, however you want to divide that. So, exercise is definitely an excellent way to make sure that you are tuning your body knows how to use the energy, your body's not storing excessive energy as fat, and you're actually metabolizing nutrients the way you should be metabolizing. Right. So the more you move, the better it is. The more you sit, the worse it is, for sure. We've also seen, our patients, and even personally, if we put on weight, you will notice your blood pressure will go up, your cholesterol panel will be off, you just will feel tired. So the more you can move, the more you can keep your BMI in a healthy range. And again, you can talk to even your primary physician over all this. Right. The better it is for your health long term. So bottom line, the more you move, the better it is.
There it is, Dr. Supreeya Swarup. We're talking about women's heart health and why it's important, just some awareness, some different signs and symptoms, and different challenges that you may face based on genetic factors or lifestyle changes. But one topic I want to switch to, and I know this may be near and dear to your heart, and it was to mine when my wife was pregnant with all three of our children. She had hypertension issues and things of that nature. And I know that when it comes with pregnancy, there's just things that inherently happen. You gain weight and you slow down and all those good things. Talk a little bit about how even as a pregnant woman and getting ready to celebrate hopefully one of the most joyous occasions, why it is important to stress taking care of your heart health, not just for one now, but also for two.
Right. So again, a very, very important topic because cardiovascular disease is the #1 killer in pregnancy. So a lot happens in your body when you're pregnant. Your heart rate increases. The amount of blood that's circulating through your body increases 30 to 50%. You can imagine that's almost doubling the amount of blood that's flowing through your body, doubling the amount of blood that your heart has to pump now. So a lot of changes happen on a metabolic and on a structural and a molecular level in your body. Right. So very important that right off the bat, you are following with your OB very regularly. They'll be checking your blood pressure. They'll be checking your pulse every time you see them. There are things like gestational hypertension, like you said, your blood pressure will rise and can rise. And that's okay, but we want to make sure it's not rising to a pathologic level where now it's danger to you and your developing baby. So very important to keep an eye on the blood pressure, on your pulse. Symptoms to watch out for: shortness of breath that is excessive. You will become short of breath because your, again, circulating volume is going up, but excessive shortness of breath should trigger that, hey, something may be off. Sometimes we don't pick up congenital heart disease until a woman presents who is pregnant. And now the congenital heart disease cannot keep up with the excessive volume. And we have seen that in our practice. So again, if anything that feels to you like, this doesn't feel right, bring it up to your OB. So very important to follow up with your OB. Other things that can happen in the postpartum, once the baby delivers, it doesn't end there. There's still, a danger zone after you have delivered. Again, watch out for your symptoms: chest pain, shortness of breath, legs swelling up. There are things that can happen, like you can have a heart attack right in that postpartum period. You can develop clots in your legs. You can go to your lungs. You can have a massive pulmonary embolism. So just, again, be very in tune with your body. Please don't ignore any signs and symptoms. Don't think that you are being a nuisance to anybody by bringing this up. This is why we are here. So please, please seek attention.
Love it. And I love that partnership, talk to your OB. I know the OBs will converse with the cardiologist. You have great relationships with your primary care provider. That just goes right in with our slogan and tagline this year of healthcare better together. And yes, it does mean better together when you have conversation patient to physician, but pulling in those other resources and your other specialists and making sure that we're giving you the total concentrated health. So I love that you tied in that connection of having those conversations with other providers, other specialists in your healthcare overall journey. back at the beginning of the interview, I'm surprised that terrible interviewer. I didn't just capitalize on a statement you said, but you talked about different screenings that are available. And I even mentioned, 40 years old, I'm going through some screening systems like now. What are some of those screenings that are available to women? I don't know if you want to say by age right now, or just what are some of the more common ones that they should be either researching or knowing about when it does come to their heart health?
Right. So again, I do want to bring up the age because I think it is an important, just parameter to know that I've seen a lot of my patients, they don't have primary care physicians. So once you turn 40, you should establish care with a primary care physician. Absolutely 100%. Great. And some of the things that they will do, and then they will escalate care if needed to a cardiologist. Some of the things that they will do is they'll measure your blood pressure, your pulse ox, your saturations. They will also listen to you. They'll do an auscultative exam of your heart, your lungs, full body exam. They'll also do blood work. And that's so important because we want to make sure you're not anemic, your electrolytes are okay, all your other parameters like cholesterol are okay. If any of those things are off or any of those trigger, any abnormal findings, then they will refer you to a cardiologist. So let's say they hear something abnormal on your cardiac exam, they'll escalate care and they'll refer you to a cardiologist who will take over. And then whatever needs to be done will be done from that perspective. But all this should start at 40 and at least once a year. Ideally, every 6 months, you should be seeing your primary care, but at least once a year, you should be seeing your primary care and make sure that we're screening your cholesterol, your blood pressure. They'll also screen you for diabetes, doing blood work, make sure you're not becoming anemic and those things. And then that's how you establish care with other consultants if needed.
There you go. So I guess it brings us to the final question. What are some things I can do today? What are some things women can do today, actually, that we can say, okay, we haven't been screened yet or anything like that, but what are just some great lifestyle choices or things? You mentioned exercise, the importance of that. But in your opinion, just what are some things that I guess will just kind of help with that before you come to the office?
Right. So again, just to tie everything together that we've talked about. So awareness, get to know your family history, very, very, very important. Next, move. I know we're all busy. I know we all have a lot on our plate, but at least 150 minutes of aerobic exercise a week will do you a lot of good long-term. Third, establish care with a primary physician. Fourth, listen to your body. Get to know your body. If your body's pointing and saying something is off, don't ignore it. Don't wait till the last moment. Really take control of your health and seek medical attention right there and then. And let the physicians know that this is what I'm feeling, and then whatever needs to be done will be done. So really important is exercise, awareness, get to know your body, and make sure you establish care with at least your primary care physician.
And this is where I plug St. Francis Medical Partners and St. Francis Hospital and this wonderful array of physicians and specialists like Dr. Swarup over there with St. Francis Cardiology Associates. You guys, heart care, health care is better together. And when you're with Dr. Swarup and her colleagues and just our physicians, you truly will begin this journey of feeling better. And that's what we're here for, is to give you that advice, show that we are the experts in our field and we're here for you, and we're here to provide that care together, as well as collaboration with other physicians. So Dr. Swarup, you have been amazing. I do appreciate your time, allowing me to take a little bit of patient time away so we can talk about this wonderful topic of women's heart health. Don't delay. Make those appointments today with those primary care providers, those cardiologists, and everybody else that can help you with your health. And we would be happy to see you in our offices soon. So thank you so much, Dr. Swarup. For everybody else,
thank you.
We will see you soon.